Jacaranda Health is a Kenyan-based non-profit organization. Our mission is to end the preventable maternal and newborn health, especially in the low-resource settings. And we want to do this through a sustainable, low-cost, and scalable solution. Hi, my name is Sylvia Mbugwa. I am a technology manager at Jacaranda Health. I've been here for about 4 years now, and the one thing that gets me excited to come to the office is the people that I get to meet and the working culture at Jacaranda Health. And we believe that all mothers should have a dignified childbirth, and also every newborn should have a safe start in life, right? And from the statistics that we're seeing, like 33% of the mothers are dying because of delays in seeking care. So we are trying to see how we can create a solution that is able to help prevent this maternal and newborn death. And we are doing this through a digital solution in partnership with the government. So how we came to know we needed a digital solution was when we saw the statistics that showed 33% of the maternal deaths were caused by delays in seeking care by the mothers, right? So we realized we needed to fill that gap, and with that of empowering mothers with information and that would enable them to seek timely care would help save thousands of lives. And another thing, when in our early stages when we were working at the facilities, we realized whatever happens before and after the mom delivers is quite crucial with the outcomes of the mom. So we thought of having a solution that works outside the facilities, right? And at the time we had the widespread use of phones across Kenya being adopted, and that was both in the rural and urban areas to a percentage of about 90% and above of the adults had access to phones. So we thought of a digital tool that you could use, and that's where SMSs came in. So we did a pilot where we sent SMSs to mothers, and we had a good response from the mothers. We were able to see they received the information pretty well, they acted on it, and they wanted more of the information. So this not only proved that prompts would work, but also that it was necessary. So our digital solution that we have in Jacaranda is called Prompts, meaning promoting mothers during pregnancy and during postpartum through SMSs. So as I said, it's AI enabled, which means we have AI integrated within the solution. It's a two-way SMS solution where we are able to send mothers scheduled messages that are gestation specific. So we know where you are at your pregnancy, and then we start sending you messages at the time. If you're 3 months pregnant, we start sending you messages from that time. And also the solution itself allows mothers to ask questions or even send in their symptoms, so that you can be able to continue providing this information that will help them know when to seek care and at the right time. Prompts itself also has a help desk team. So the help desk team, when we receive questions, the AI itself triages the questions and then determines if it's a high risk question or low risk questions. For the low risk questions, the prompt itself generates a response and then sends the response to the mom. And then for the high risk questions, we have a referral process. So where we have this question come in, we send it to the help desk team. The help desk team can either do a voice call via AT and call the mom, to ask what's going on, and also give a referral. or advice on what they need to do. The one thing that we were looking forward to was like some of the services that were offered by Africa Stocking. So we had things like bulk SMSs, because we are trying now to send these many messages to mothers almost at the same time, because now you see you have this scheduling of the SMSs, so you want them to go almost at a certain time. And then we needed to have a short code which mothers would remember, and also we would be able to do the communication to and from. And some other things that we were looking at was, are we able to like monitor, see how the system was working? And this was something that Africa Stocking had already provisioned. And at the very end also, we were trying to see what's the easiest way to sort of integrate the SMS into our platform, the Rapid Pro. So Africa Stocking had like a webhook which was already like could easily integrate with the Rapid Pro, which we were at the time trying to integrate. So looking at all these things, we were able to like see Africa Stocking would work for us as the SMS platform. Now, after figuring out like we want AT, we went to the point where now we have to do the integration. So we communicated to the Africa Stocking. When they got to us, we had them walk us through like how their API, SMS API works. So they explained how it would integrate with our system, how we would use the APIs, and also they helped us design like our architecture in a way that suits the whole pipeline. Another thing during the implementation was, now when we've already like understood what's how the API works, now we need to use it to now build the system. So part of the thing that Africa Stocking did was to actually help us troubleshoot and understand like some of the challenges we were facing with the development. And this was quite a collaborative and supportive venture, which helped now move from piloting of prompts, where we've now integrated the API, to actually seeing it live and being used by mothers. And yeah, from that, now we get to the scaling part, where we have already seen it works. Now we were trying to move now to more facilities and provide this solution. So at the point we've had like we have required to have a lot of coordination with Africa Stocking, so that we can ensure the system remains reliable and available to the mothers. Africa Stocking has been quite essential or crucial, I would say, in terms of us being able to reach more mothers than we actually had planned. I think when we were starting off, we envisioned like having this solution go to like thousands of mothers, but now we are currently saying we reached like about 3 million mothers. So that scale is something that Africa Stocking has been with us through that journey, and now we are going to expand. We are even expanding to other countries, and we are currently in our 4th country. So I would say the scaling, the fact that you're able to coordinate this scale and have the system be reliable, be available, we have like support in case there are challenges, has been really impactful in that sense. And in terms of the health outcomes, from our study that we did, we have had like 20% more of mothers who are in FROMs being able to go to more than 4 ANC visits, which is quite huge. And also we have had like mothers 2 times more likely to uptake family planning during postpartum. So we have a story about Faith, our mother in Kakamega. So when Faith was in her first pregnancy, she started experiencing an unusual bleeding, and this caused her to panic, right? And at the time, her husband was away at at work and now was coming back. So by the time he got home, the issue had already escalated to a point where at around 9 p.m. Out in the evening, the bleeding had gone to a point where it was soaking through her clothes. Yeah. So in a state of panic, Faith sent a question to our prompts, asking saying the blood, there's a lot of blood, what do I do, right? So our AI-enabled prompts was able to pick up on this question, try it, and determine it was an emergency. And in that situation, it sent a response with critical advice telling Faith to go to the facility. Our clinical team was also able to pick up on this question and did a follow-up call, emphasizing on the need for her to go to the facility. So Faith went to Kakamega County Hospital, where she was able to get treatment. Although she experienced a miscarriage, the pain of miscarriage, she was safe. So the next morning, our clinical help desk was able to call Faith, following up so that they would know what the state of Faith. And during the conversation, Faith was asked if she wanted to get counseling from a partner organization called the Nabinti. Faith expressed that this was new to her because she expected the society seems to expect her to just move on after experiencing such a thing, but at this point they asked if she needed counseling. So currently Faith was able to get pregnant again and also have another baby. So yeah, she's a mom now. Faith, through this story, Faith is among the 3 million mothers in prompts who I would say prompts has helped to seek care at the right time and at the right place. For the healthcare providers looking to create a digital solution, I would advise at the first thing, understand what health issue are you trying to address, what gap are you trying to address. For us, it was the delays in seeking care, and this helped us build a solution around providing this information so that the mothers would know when to seek care and at where and at what time. The second thing would be to get technologies that actually understand their context. So for us, when let's say we went for Africa Stocking, we went because they were able to understand the telcos around us and how we would navigate the solution that we needed to build. The other thing would be also to think, when you are trying to make a solution accessible, what is the best channel to use? What's the lowest common denominator? For us, it was SMS. Every adult person has access at least to a feature phone. So knowing that SMS would help with accessibility of these prompts actually led us to build the solution that way. Also have a feedback loop where you're able to, once you're building the solution, you're able to collect feedback, and that would help you iterate your systems.